Hey guys, Dr. Brenda Tapp here. I'm a naturopathic doctor and clinic owner of Peterborough Center of Naturopathic Medicine. I wanted to talk to you guys and clear up some misconceptions around food sensitivities. Food sensitivities are an immune reaction against certain foods that we eat. It's not an allergy. Quite often they're referred to or confused with food allergies, which are like your peanut allergies. They cause things like your throat to swell, anaphylaxis. So food sensitivities are definitely not a food allergy. Food sensitivities come about when your white blood cells, your immune cells, produce something called immunoglobulin G, IgG. These are produced when you also have an infection. So a lot of infections are actually tested for in your blood work with your immunoglobulins, IgM, IgG, and this tells us if you have a current or previous exposure to an infection. So when you have elevated levels against these foods in your bloodstream, that's a sign that your body is responding to these as foreign and may not like that you're consuming them in your diet. These little protein immune complexes, immunoglobulins, will then create inflammation in the organs in which they deposit themselves in. So for many people, it can present as digestive issues, abdominal pain, diarrhea, constipation, but sometimes it also presents itself as joint pain, worsened arthritis, worsening of autoimmune conditions, can cause skin issues, acne, headaches, migraines, brain fog. It can worsen symptoms of ADHD and autism. So it can cause quite a few symptoms. And the way that we treat someone with food sensitivities is by avoiding them in your diet. So the easiest way to look into what food sensitivities you have is a blood test through a lab called Rocky Mountain Analytical. Rocky Mountain is owned by Life Labs. Now, you can also look for food sensitivities by doing what's called an elimination diet, where you remove most of the common food sensitivities from your diet for a period of time, and then you add them back in one at a time and you watch for your reaction. I like the blood work. I love testing. Testing is the easiest way to prevent guessing. Now, there's a lot of misunderstanding about the test. Sometimes physicians or even patients will say to me that, oh, well, of course it's high. I ate a ton of that. So of course it's going to be high in my blood work, but that's not actually the case. Let me give you some examples. Not once have I ever seen chicken come up high, and most of us eat a lot of chicken. When I read someone's food sensitivity test results, quite often, maybe about 75% of the time, I see egg come up high, but not the full egg. It's either egg yolk or egg white. It's one or the other. And most of us will eat a whole egg. We'll boil an egg, we'll fry an egg, and we're eating the entire thing. So if the result is high because of overconsumption of an egg, or of eggs in general, then you would think that both parts of the egg would be high on your blood work, but I never see that, never. The same applies to dairy. This particular test by Life Labs and Rocky Mountain Analytical separates out your casein and your whey protein, which are two different proteins that are found in dairy. If your dairy is high because you eat a lot of dairy, cheese, yogurt, ice cream, butter, that kind of thing, why is it that I really don't see both whey and casein come up high? Because if it was high from overconsumption, both of them would be high. Cow dairy is high in whey and high in casein, but it's typically one or the other. Usually casein. So I completely disagree with the idea that food sensitivities come from overconsumption of a food. Food sensitivities come from eating too many processed foods, from eating food that is covered in pesticides that our body doesn't, or herbicides that our body isn't used to eating. That's where food sensitivities come from. So if food sensitivities sound like something that you may have or that you're interested in testing, we have these little patient guidebooks here at the clinic. So feel free to stop into the clinic to pick up your guidebook. It has lots of interesting information in it about what food sensitivities are, how to differentiate them from food allergies. Yeah, so we're here to help. If you think you might have food sensitivities, let us know. Getting better and feeling better is not always about taking supplements. Sometimes it's just about adjusting your diet to allow your body to heal and to heal your digestive tract. Yeah, so if this is something that you think you might need some help with, please let us know. We are happy to help. All right, take care, guys. Bye.